Good afternoon, everyone, and welcome to the this week's AMPC webinar. As many of you have already been on a number of webinars, we have Simon Booth from Aegis Insurance along with Jay McGrath from Aegis Insurance, and today they're going to be talking through a workers' compensation initiative project that we've had going for the past probably 12 months now, I guess it's coming up to, and it's actually a follow-on project from a project that Simon and Jay worked closely with AMIC on originally, which was around collecting the data on injuries and injury prevention in the industry. We've also got Davin Skygetter, who's joining and is one of the key resources that Simon and Jay are going to be using in some of the publications as part of this project we're going to be putting out shortly. After Simon and Jay present today, we're going to have Gemma Harper, who is our co-innovation manager in Victoria. And I'm sure a lot of you have probably already met Gemma, for those of you that are online from Victoria, and she's going to give us an update. There's been some changes recently in Victoria around eligibility for safety grants. So Gemma will touch base on that. And then I'll give you a little bit of an overview of some of the other safety initiatives that we've got going as well. So if anyone hasn't used this platform, we really encourage questions. Please feel free in your question tab bar to type any questions, and at the appropriate point, we'll try and get as many questions as we can answered today. If you've got any other comments, please feel free to put those in the chat to everyone as well. And without further ado, Simon, I'll hand over to you. Thanks, everyone.
Thank you, Amanda. So today, guys, I just want to run through, I guess, where we're up to with the initiatives that we've put in place as part of the project, what's still to come, what had to be postponed due to COVID, and give you a bit of an update on some of the other things that are going on. So of the 23 milestones that form part of the project, we've completed 13 of those. There were only 2 milestones that haven't been completed at this point due to COVID. And throughout the process, there's been a significant amount of collateral for the industry that we've developed. After today, Amanda will be starting to send some of this collateral out so that the processors can actually start using that to try and get better gains and better outcomes in return to work and safety. So if we start, if I can make my computer work, one of the first things we did as part of the project was put in place an advisory line. This was meant to go for 12 months. It wasn't really, it hasn't really been taken up like we'd like to see. So we're actually extending that through to February next year. And this advisory line is there to help with any questions relating to return to work, safety, HRIR issues. And we encourage people to reach out. It's a free service for everyone in the AMPC or AMPC members. So I encourage you to make use of it. The number's on the screen. We'll probably arrange with Amanda to send a reminder of all the details back through. But reach out and give it a call. You've got experts at the other end who can just provide a little bit of advice, even just a sounding board for decisions you're already going to make. Jay, I'm going to pass over to you for this one.
Thanks, Simon. One of the things that we did early on in the piece and a couple of stages last year was to go through and identify those things that we considered most contributed to those musculoskeletal and soft tissue injuries and how laceration injuries were occurring. The project came up with, we went through, we surveyed a number of people. There were 19 responses, which is not probably not what we really wanted. We would have liked a bit more than that. But ultimately, when we look at the combination of the two, and because Simon's driving the slides, he's taken the third one. I was looking at the first one and I was trying to work out why my numbers were different. But we didn't get a massive amount of surprise from it. We identified that, you know, one of the highest issue we have is the likelihood of a musculoskeletal or a lack in boning. Certainly with a boning perspective, we've got a lot of work in relation, obviously we've got a significant amount of of knife exposure, so our lacerations are going to be more likely, but equally it's that smaller, repetitive, ongoing manual handling stuff, and there's soft tissue issues of that repetitive wrists and arms and shoulders around boning and the turning of meat and the like. The other significant components were also what we would have expected to see as well in relation to that, the pushing of carcasses and loadout. And we know that traditionally we still have these processes within that area where many of our rails are still friction based. So whilst we're pushing things along, we're pushing them along on a steel on steel process, which is, has the potential to deteriorate over time. And the other significant one was around that slaughtering process. There's a fair bit of manual handling work within there. There are a lot of pressures on people in that slaughter process where we're trying to guide animals into a chute or hanging legs and that sort of process. That is the issue. So nothing really in amongst that stuff surprised us. And the report, Simon, can you just comment briefly, or Amanda, on where we determined that this report would go? Has it been delivered to the members yet?
So, Jay, in part of the presentation we did at Beef Week, we have presented the numbers, and we've probably had some more internal discussions. It was hoped that the network meetings were going to be up and running, and we're going to present more of these findings then, but unfortunately with COVID, we haven't been able to get those up and running yet.
I think what we will do, thanks, man. So I wasn't sure whether it actually gone out. One of the things that we will do as we progress through the next series of workshops and days that we have, we will incorporate a lot of this stuff into the things that we talk about. And certainly some of the other things that we'll look at in this session now, we'll deal with those things. It's interesting when we look at these surveys, we know that boning and that loadout component were high. If we look purely at the musculoskeletal stuff, the pushing and the loadout was the highest, obviously, and then from a laceration process, that boning aspect was the most significant. So nothing surprising, but what it does is says to us that even with the controls that we've got in place, we are still seeing injuries and a level of concern coming from these areas. Simon?
So one of the things which we'll talk about in a minute, the purpose of this survey was to identify the top 5 and have those assessed, and that's another milestone which we'll talk about later on, and that's now been completed. One of the probably interesting things we see in workers' compensation is employers doing what they think seems reasonable, which sometimes can not comply with the legislation. And one of the things that came out when we went and did the actual interviews at the 30 processes around Australia was a theme of employers encouraging people not to lodge claims, going as far as paying for things themselves. Don't lodge a claim, we'll cover your work, we'll cover your time lost, we'll cover your injuries. The only issue with that is it's actually against the legislation. So part of getting this is actually trying to help educate the industry on what they can and can't do, because the last thing we want to do is see a regulator in a state get wind of these practices, because then they'll go through and actually audit the entire industry, and that will mean that a lot of the things that we're seeing and trying to do now to bring down the rate, if this comes out and there's an ongoing practice of not lodging claims, we'll see the rate skyrocket. So one of the things we did was get FCW lawyers to actually go through state by state and put together a practice note or a guide on what is deemed premium evasion or coercion to not lodge claims. Amanda, have we sent that out yet?
So I was going to send those out with a copy of this webinar after they've been presented today.
Perfect. So worth having a read, and if you've got any questions, give us a call. And if it gets to the point where it's very legal and we can't answer it, we'll try and get you a bit of time with the guys at FCW. But at the end of the day, the scheme is there for a reason. It is meant to help people with claims. So anything you're doing to encourage people not to lodge claims, and this went as far with some of the people we interviewed where they actually had a form prepared, which they put in front of workers and say, now, if you don't want to lodge a claim, sign this. They said, oh, but they signed it. And I said, yes, but at the end of the day, the mere fact that you have a form would suggest to a good lawyer or to the regulator that you don't want people to lodge claims. If someone really doesn't want to lodge a claim, all that is a file note in your folder to say, we've given them all the information, we've asked them to lodge a claim, they've told us they don't want to. Sign it. But when you start going to the trouble of preparing what you feel is a legal document that may or may not take someone's entitlement away to claim, that's when you start to fall in a very precarious position.
And can I just say that regardless of how good that legal, for want of a better term, document is, it has no standing at all. The worker can sign all sorts of documents and say, I'm not going to lodge a claim, I'm not going to lodge a claim. They can lodge a claim and your contract has no standing whatsoever. So
you can't give up a legislative entitlement.
Can't contract out of the act.
Yeah. Jay, workplace safety compliance checklist that you created.
Yes. Again, Amanda, I expect this one might go out with the notes to this webinar as well.
Yeah, this one has gone out previously, but I think we'll put all the collateral together that's been created out of this project to date, and we'll send it all out with a copy of the webinar so that everyone's got it in one package now.
Yeah, so what we've done, Simon, I'm not sure what you have on the next slide, if you have anything from this document. But
no,
what
I
it
don't.
does, no, you don't. So what it does is a 2-page document that goes through and identifies all of those things that are an absolute obligation on the employer. And we've made it very much a catch-all across all jurisdictions and identify that you need to have these things. Some of them are very, very obvious, like you need a workers' comp policy and you need those sorts of things. But other things that are not so clear that you need to have and you need to be able to evidence, like you need to be able to evidence that you've provided time and resources to make sure that safety considerations are maintained. Right, so you've got to be able to show all of these things, and you've got to have registers of injury. You've got to have these types of things, and you've got to have processes to make sure that you have the capacity for consultation within the organisation, where someone can raise any issues of concern that they might have. And we need to make sure that we're able to show that people do raise things and they are taken as what they are. The raising of an issue doesn't mean that someone's right, and someone needs to be able to raise something and have a discussion about it. If it heads on from there, then you can have some debate about that. But the raising of the issue has to always be allowed. So there is, as I say, a 2-page document that has gone out. There are some specific details around the type of plant and specific equipment that needs to be registered or controlled in each of the jurisdictions. So that's a useful document. Hopefully some people have seen that, have been able to utilize that. And regardless, as Amanda just said, it's going out again in the notes with this. So I recommend to everyone that they just, if nothing else, flick through it and say, well, I do that, or I'm comfortable that I don't have to do something else. And again, if there are any questions, call Simon or I directly, or just go through the fantastically well-resourced helpline, like the one we put earlier.
Yeah. So one of the other things we did, which ended up being done through, well, the first one was done in person here in Victoria, but the rest were done as webinars, was some training. And the topic we chose, the first one was bullying and harassment. We covered off, how's that, look from the legal perspective. What does wellbeing in the workplace look like? How do you manage a claim for, that relates to bullying and harassment? And what's the process of investigation look like? Well, there is another set of workshops that will be conducted probably in the first half of next year, COVID willing. And at the moment, we're looking at a couple of topics, including some which I'll go into a bit later on now, is the changes to the safety legislation in New South Wales, Western Australia and Victoria. And those are the changes that we expect to flow on into other states. And I'll go through that a bit more at the end. Milestone 9. So one of the things we looked at throughout the project was return to work coordinators would generally do the obligatory return to work training course. Sometimes they'd done that 5, 6, 10 years ago and hadn't done any other training. So we looked at from our perspective, what are things that would be good for return to work coordinators to know? And we've developed 2 training programs to assist return to work coordinators in I guess, honing and enhancing their skills. Again, this is an in-person training, so we've had to push that back. We were trying to hope, Amanda, with the next round of network meetings, but we'll have to see how that pans out. Worst case scenario, they can be conducted as a whole day training in the new year. Mr. McGrath.
Assessments, all right, I've taken this out of order. Thank you. One of the things that we did as part of that process was to identify those hazardous tasks that we talked about, those top 5 things that were creating those issues for us from a manual handling and particularly in this instance from a musculoskeletal process, to identify those manual handling issues. And as we went through, we together with Body Care went through and identified, thanks to one plan, reviewed all of those issues that had been raised. So the boning, the loadout, those processes. They went through all of those. They identified 5. We identified for them, and they assessed 5 tasks. Those tasks being boning, the push-out loading combo, slaughtering, packing, and skinning. And the body care consultant went through with myself and a couple of the guys from the processor and went through and broke those down and identified the specific elements contributing most to the hazardousness of those processes, and came up with a really good document that I don't really want to go through here too much, because it's one of those things that is really worthwhile as a resource for all of the processes to be able to go through, identify the issues. They raise nicely issues around the types of problems that come from the different aspects. And for example, one of the first bit that they looked at was just that basic boning floor worker, who is just your basic boner. Working through that process and identifying that it's about the repetitive cutting, it's about the pulling and the force that's required. It's about the heights of people doing that process. We know that generally we've got a fixed height bench and a fixed level floor, yet we have people that range in height from 5 feet tall to 6'10". And the issues for them are significantly different. And it goes through and identifies the number of those specific controls that are in place at the moment. So it's a useful tool to go through and identify for any processor to go through, identify these are the issues. If they are issues for you, these are some of the controls that are in place at the moment. And then we identify as part of that some additional processes, some additional changes that may occur as part of that process. So it's really useful to do. I like to look at this from my perspective as something of an ongoing document / Bible process. And I'd love feedback from anyone that gets the opportunity to have a read of this as to what might be added to, changed, and assisted with, so that we can spread that across the industry as a whole, remembering that this whole intention of this whole project from the very beginning was to make this industry safer than currently then was. We have a lot of controls in place at the moment with the things that we do, and there was another study that I think we're talking about in a moment that talks about the effect of some of those controls, but I think it's really important to continue to improve. So I would love anyone that has the opportunity to read this document to shoot me an email, give me a call, and we'll set down a little bit of time to talk through what you think and what you do and what you think might help others.
It's quite possible that some of these, sorry, Amanda.
Sorry, I think also, Jay, as a comment, for those companies that don't have job dictionaries, it will actually give them an idea and a basis of what a potential job dictionary can look like. So when they're talking to their physios, doctors, and other rehab providers, they can actually then start taking those job dictionaries or those job tasks to the medical professionals with the employee.
Yeah, and most certainly this, you know, the photos in this document are really in many ways quite sufficient to take to a doctor. They've been debranded and dehumanized, as I recall. So yeah, free to use as you wish, as Amanda allows.
And remembering, you know, none of the things that we're looking at here are new issues for the industry. So it's quite possible that some of you have already dealt with one of these issues and had a successful outcome. So they're things that we want to know about. You know, if you've addressed it, if you've actually said, hey, look, what he's got in here is great, but we just did this one simple thing and that seemed to have solved the problem, let us know.
But remembering, these are not things that we made up. These are things that you, the processors, told us were the problems. So for some people, these are still issues. And in reality, they're issues for everyone. It's just a level of control that is the thing. If you take the controls away, these things are going to be absolutely problematic. So
one of the things that was a constant theme throughout our initial project was issues with treating doctors and not, you know, keeping people off work for longer than we expected they should need to be. Anyone with a laceration, sending them straight for surgery instead of just doing suturing in the surgery in the doctor's practice. So one of the things we did as part of this, we actually reached out to some physios and some specialist medicos to look at how should a doctor be approaching treatment for musculoskeletal and laceration injuries? And then in line with that treatment, what does return to work look like? You know, and reinforcing that, you know, for most injuries, return to work should be pretty immediate. There's very few injuries where someone needs significant time off work. These will go out as well after today. We're just waiting on a little title change on the ones about laceration. These will go out from Amanda, and we encourage the return to work coordinators to actually provide these to doctors, not as a, this is what someone else has said and beat them over the head approach, but hey, we received this information. The industry's doing a lot of work into this. Here's what some people have said we should be looking at in relation to treatment and return to work. What do you think? So get that discussion and dialogue going in a manner that gets the doctor to understand that you actually want them back at work, and more importantly, that you care about getting them back quickly. One of the things that you'll find in the laceration piece is there are actually a lot of situations where the GP should be referring for surgery because we want to make sure that there's no underlying damage. And that's something that, until we started looking at this, hadn't crossed my mind. Why don't you just put a couple of stitches in it and see how it goes? But if we can have a look deeper and fix the real issue straight away, then we're not going to have an ongoing problem. So, but these will come out in digital copies, so they can just be reprinted, sent out with, you know, with any of your workers. Given that I think it was something like 80% of injuries in the industry were either musculoskeletal, soft tissue, or laceration injuries. So the majority of the injuries you're having, these fact sheets should assist you.
And these are not something that we necessarily want to be handing to the doctor and saying, this is what you've got to do. It's a case of educating the doctor about this is what we in the industry are doing to assist the management of these types of injuries, and work down that process and bring them along for the ride.
Yeah. Again, you'll get a lot further creating dialogue with a doctor than you will yelling at them. So, in fact, I don't know many situations where yelling at someone's GPs actually resulted in a return to work. So, one of the other things that we've created is an online library. Now, this at the moment is sitting waiting a platform for it all to be placed on. But the concept here is one central point where employers can go to get information relating to workers' compensation in every state, safety in every state, and HRIR issues across the country, broken down and presented nicely. And this is being updated all the time. So not just this holds a lot of information that you'll find on regulatory pages, trying to bring it into one platform for you. But even the information that we've been creating, those doctor cheat sheets, fact sheets, so forth, they'll all be placed into this library. Amanda, where are we up to with identifying how or what platform the library is going to be placed on?
Yeah, so hopefully we'll have that sort of finalised in the next couple of weeks, and then we'll make sure the membership knows exactly where and how to find all the resources.
Excellent.
We've just been doing it on our website at the moment.
Perfect. All right. Sorry, broken. There we go. Too far. So one of the things that we looked at as part of the study was the impact of age in relation to claims. And what we found is younger workers having high frequency, low severity claims, but they're having a lot of them. And the aging population, 55 and above, having a lot of soft tissue injuries that were having a lot of time off because of them, because their bodies are breaking down, they don't recover as well, and they're not as fit and hearty. So one of the things we're looking at, and I'll get Davin to talk about where he's up to in a second, is actually running some campaigns through social media, some videos and so forth that you can utilize during your induction processes to help younger people understand and appreciate the hazards in the industry, so they don't go in all gung-ho. And some of the things we've seen is, you know, severe lacerations, scaldings, chemical burns. You know, Jay and I have experienced one where a young man cut a few fingers off with a hot cutter. All these things that, if the younger workers appreciated the dangers a little more or the hazards a little more, were preventable. It's not to say it's a bad industry for younger people to go into. In fact, it's not. It's a great industry, and there's a good career path for people. But we're finding, and the feedback from a lot of you were, they don't appreciate the hazards. And so to try and give them that appreciation at the start will actually provide, will hopefully provide some decrease in some of these really preventable injuries. From an aging population perspective, a lot of it also comes back to you as the processor, understanding that there needs to be transition plans. And you know, part of what we're looking at here is, again, a similar process to get people who are aging to understand that they can't do this forever, but also to help you as processors understand that, you know, a 67-year-old man probably shouldn't be boning anymore, because, you know, that's a recipe for disaster, potentially a long-term claim, but more importantly, from a human perspective, potentially going to ruin that person's retirement. Dav, do you want to take us through the concepts you're looking at, where we're up to, and I guess how far from completion you think we're going to be?
Yep, no worries. Thanks, Simon. And yeah, apologies, I haven't been able to convince my laptop to let me let everybody see my face, so it's audio only. But yeah, so what we looked at, and I've had the benefit of working on a few projects like this, not only working on projects like this, but seeing how they've been rolled out and sitting in workshops and seeing the kinds of video and the kinds of media that has an impact. And you know, the general kind of preachy, don't do this, don't do that kind of material doesn't seem to be as effective as when, you know, employees are sitting and watching real world stories and people talking about their experiences and the impacts of those experiences. So that documentary style of video content. So that's sort of where we started to look and explore some ideas, and we thought that if we were able to do some scripting with that sort of media strategy in mind, and then maybe recruit some actors to kind of play the role of maybe an aging worker and a young worker, and telling stories that are real, that have had an impact on them, and the impact that's had then on their lives external to their working life, we think would get some cut through and you know, good engagement, and it also enables us to maybe start with a longer form of video, so maybe sort of a 5, even maybe a 10-minute sort of length of runtime, but then that can be cut down into shorter snippets, and distributed across different platforms like Facebook and LinkedIn, you know, as well as YouTube, and you know, can be played within workplaces as well. So where we're at now, we developed some ideas around like I said, an aging worker and also a young worker, and we sort of narrowed down a specific incident for each, and we've scripted both of those videos. So what we have is a presentation of the injured worker, going over the incident, their managers and maybe colleagues who witnessed the incident, the impact it's had on them. And then we talk to their family and the way that it's impacted their lives. So for the aging worker, the impact maybe is on their ability to travel in retirement. The young worker may have, a permanent physical injury or even sort of mental health consequences of what took place. And so once we get sort of sign off on those scripts, we'll be ready to start the actor recruitment process, and we're ready to start rolling.
And Dav, you should have those scripts through to Amanda in the next week for review.
Yeah, so they're written and ready to go. I'll just maybe go through them a few more times and get you, Simon, to take a look at them before we send them across, and then we're all systems go if everybody's happy with the content.
And just to give a bit of background on Dav's done work for places like Toll, Visi, Patrick's, Eastlink. So we've got someone who understands, safety in large organisations, has already done videos for some large organisations. So I think he's well placed to help us get the message across inside the meat industry.
And you may be wondering why we would use actors instead of maybe actual workers. We've had a couple of instances where we have used real world examples, and those people haven't necessarily learnt from their past mistakes and have had subsequent repeat injuries and have left the organisation. So there's other things that come into play when you're using real world people. So the ability to use actors, keep the stories as true as possible, but the ability to use actors means that we've got longevity with the content, and you can use it for for long-term periods.
Excellent. Thanks, Dav.
No worries.
Okay, Mr. McGrath, another survey.
Here's one we prepared earlier. This is the one that I was speaking of before, and this is one where the second of the surveys that we looked at was identifying what the overall hazards are. We knew that we had done the work in relation to musculoskeletal issues and lax, but we asked two questions. We asked in a survey, asked people to give us the top 10 most hazardous activities, ignoring all of the controls that were in place. And the specific question was, ignoring any controls in place, what are the top 10 most hazardous activities? And then we asked the second question that, considering the controls that are in place, so after we've controlled them, after we think we've fixed it, what are the remaining hazards that might exist in these circumstances? And this survey was quite instructive, and we learned a fair bit. We identified, I don't know whether you got the table there, Simon. Yep. We identified with some little bit of fancy maths that knives were the most hazardous task that we have if we just forgot about any controls. And then mobile plant were second, and then manual handling third, by a long way, so by 50% over the top. It's interesting as part of this survey that hazardous substances were somewhat significant as well on site as those great controls. But then when we look at it after those controls have been applied, what I found quite interesting here is that according to the industry, or according to the people that responded to these questions, we've got our controls in place around hazardous substances because they're no longer in our top 10 at all. So we believe that we've got those controlled. We believe that they're significant, but we've got them controlled. But equally as interesting and somewhat surprising to me is that knives, whilst they were the highest uncontrolled thing, with all of the controls that we have in place around what we consider to be the most hazardous tasks, even with the controls in place, we still consider them to be the most hazardous. Now that says to me one of two things, and I do not know what the answer to this is, and happy to talk to anybody in the industry across this thing. Either we've done all we can and they're just going to continue to be dangerous, or we haven't done enough. And I'm not sure what it is. I believe there's opportunity to improve the control of that hazard. but it's a case of how best we do it without removing knives from the scene altogether. Interestingly as well, mobile plant were considered high prior to the controls we had in place, but we also felt as an industry that once we put those controls in place, mobile plant dropped from second with a bullet to very low down in the control aspect. So I found that quite interesting, and it says to me that knives and manual handling remain the most significant issues that we have, and the way it was quite difficult in the way that we did the survey or the way that the survey was answered. I would consider largely manual handling and ergonomics to often be very similar things and somewhat go hand in hand. So it may be that those things bulk us up there as well. But I'd be interested in any feedback after you have a look at this report and some of the commentary in it, although it is very brief. Would be happy to talk about that. But it says to me there remains a significant opportunity to further control the hazards created by knife use.
And Jay, it's actually consistent with the survey that was done in the original project with AMIC, that lacerations and musculoskeletal injuries came up as our top two injuries across the industry as well. So yeah, it is consistent with those findings. Yeah. That survey was done 3 years ago.
But whilst we consider mobile plant to be significant as well, we seem to have that control, and we seem to certainly have hazardous substances control, but we've not yet got knives control. I don't know. I find it interesting, at least.
What is interesting is when we did the initial interviews, whilst we were collating the data in the background from the claims, most places of interviews said, no, knives aren't a problem anymore, lacerations aren't a problem, we've got our PPE. Then when we got the data and we went back out and started talking to them and said, well, look, you said this wasn't an issue. And then it started to come out, well, maybe we don't enforce PPE. Maybe we've got the wrong type of PPE. All these other things, but it seems in these situations, Jay, people were a lot more aware of the issue and that it was still going than those who thought, well, we bought someone a glove once, there shouldn't be a problem anymore.
Yeah,
which we see a lot.
Agree. We've got gloves. Well, if we've got gloves and gloves are the solution, how do we still get lacerations? And if anyone wants to tell me, anybody wants to show me a plant that's not had a laceration in the last 18 months, I'll give them $1.
Oh, dear. So where to from here? So obviously we've got the return to work training. So once we can get on with these network meetings, that'll be the first one that we run. Encourage everyone to get their return to work coordinators along to it. The first one is a little dull, a little dry. It's just about the process, gathering information, why it's important to gather information and how. The number of places we went to where the return to work coordinator wrote their notes in their diary about claims. Now that's great, but what happens when they leave? Even if they don't take their diaries with you, if they do leave them, do you know where the diaries are? Do you know when things were done? So the importance of getting a good solid process, how and when to make contact with workers and doctors and the insurer, and what information to be gathering along the way, and how to identify barriers, all those sort of things to keep things moving. The media campaign, which obviously Daz already spoken about, will hopefully be completed sometime in the next 2 to 4 months, COVID dependent. Jay will be writing up, based on that last survey, some general hazard control measures, controls and measures relating to the top 5 hazards that were identified, even after controls are in place, just to provide some additional ideas on how these things can be addressed. Once again, you might find that you're doing 80–90% of what Jay comes up with, but if there's 10% in there that can help you improve, it's worth a read. Our workshops in 2021, I'll go through again. The topic on that will be around the changes to the legislation, which I'll talk about next, and then our final external milestone is another return to work training, which is around how to engage doctors and injured workers. If we look at most states at the moment, especially two largest, Victoria and New South Wales, when it comes from a workers' comp perspective. We're seeing the schemes change in a way that is not beneficial for employers. The control that the insurer used to exercise on injured workers seems to be laxing. If we look at New South Wales, they tried to treat people like motor vehicles. That's failed dismally. They are now having more trouble getting their own house in order and focusing there than they are on actually getting people back to work. In Victoria, the scheme's gone passive. They are scared to make adverse decisions on workers after the Ombudsman's reports. So the aim of our engaging doctors and injured workers is, what can you do? What can you do by better engaging your workers and better engaging their treaters to get someone back to work? And it's from our perspective, I think it's a pretty good workshop. There's a nice little workbook that comes along with it for references. And our aim, as always, is to educate and help people take that out and improve in the industry. So finally, just want to run through, some of you are probably aware of this, some of you might not be. Last year, New South Wales amended their legislation and made it unlawful to enter into or provide or benefit from an insurance or indemnity agreement for a work health and safety fine in New South Wales. Cut that back. If you are prosecuted by the regulator for a safety breach, your insurance can no longer pay the penalty. All right.
So if you get a $100,000 fine, it has to come out of your pocket. It is not insured.
And I think the maximum penalty in New South Wales now is somewhere up around $3 million. And I don't know many companies that want to part with $3 million out of their pocket. Moving forward, what we've seen is WA passed that legislation. I think it was late 2020, November or December last year, they passed the legislation and are waiting for it to come into effect. So in WA, it will be the same. You will no longer be able to be insured to cover those penalties. And just recently, Victoria put an amendment bill to Parliament for the same, and we've got no doubt that that will be passed. So with that in mind, one thing that will still be covered is your legal expenses, which do rack up, but there's you don't want to be reliant on a lawyer getting you out of a prosecution. What you need to be doing is everything you can to not put yourself in a situation where you will be prosecuted. Ironically, safety, there's a few people who have done reviews of safety across Australia over the last 30 years, and we found, a marked improvement to the point where some people are saying, based on, current technology, if people are safe, there's not a lot more they can do. Well, what we're saying is go back and make sure there's nothing you can do, because the last thing you want to do in any of these states, once all these legislations come into play, is be prosecuted, because that money will be coming out of your pocket. We expect, like we see in a lot of places, that legislation, these amendments will take place in every other state in Australia somewhere in the next 5 years. So be prepared. And my final, and I'll give you some very general advice here. Go talk to your insurance broker, find out what they know about the changes and how it affects you. If you've got legal representatives, have a chat with them, get a firm understanding of what will or may lead to a prosecution, and talk to your safety personnel and get them to go through your workplace with a fine-tooth comb after an understanding from your legal representatives of what will lead to a prosecution, and ensure those things are covered off. All right. In reality, most of the situations where we see someone prosecuted by a regulator were preventable. And if they weren't preventable, we probably wouldn't have seen a prosecution. Okay. So go back, have a really good look, understand the new limits of your policy, make sure, and if we look at, I think New South Wales is saying, oh, well, look, if you've already had a policy in place and we get something that happened 3 years ago, this prosecution, we'll cover it. You're allowed to cover it. Victoria, from my understanding, is saying, nope, as of the day that this amendment comes into practice, it will be illegal to still be trying to cover things in the past. So there's going to be a big hole for some people in Victoria. So if you have any prosecutions undergoing in Victoria, or you have some that are pending, you might want to have a chat with your lawyers and see what can be done to try and resolve that as quickly as possible whilst you were still covered. Okay, and that, Amanda, is all from me.
Fantastic. Well, so far, you must have covered off everyone's thoughts and ideas because you've got no questions coming through. What I might do now, and it's a good leeway, segue in, I'll hand over to Gemma, who will give a bit of an update on what's happening in Victoria around some grants. Gemma, are you online?
Thanks, Amanda.
Perfect.
Can you hear me?
Yes, we can.
Wonderful. So just wanted to provide a really quick update on some grant opportunities through WorkSafe Victoria. So WorkSafe Victoria have recently released a pilot round of grants, which they're referring to as their Smarty grants. So as part of this pilot round, they have revised their previous grant guidelines, which is quite exciting for a lot of our members in Victoria as far as eligibility goes for the grants. So up until this round of pilot grants, you may or may not be aware, but any business who had ever been under investigation, received a fine, or a conviction had been excluded from receiving any of these grants. This was revised as part of a review of the grant guidelines by the WorkSafe Victoria board a couple of months ago, and this has been amended back to within the last 5 years. So the current pilot grant round is open until the 18th of August. These grants provide opportunities for any Victorian business to apply for funding for health, safety or wellbeing projects. If any member was to apply and be successful with any of these grants, there's also a further opportunity for leveraging of that funding through the AMPC PIP program. So following this meeting, I will send out some correspondence with the links to the Victorian WorkSafe website, grant application component of their website. I'll also attach the grant guidelines for your information and review. If you don't receive an email from me, please reach out because it just means it's been sent to someone else within your organisation. So exciting news around eligibility of potential grants for Victorian members. Thanks,
That's
Amanda.
fantastic. That's fantastic, Gemma. Yeah, and definitely anyone that may be interested or wants more information, please get in contact with Gemma and she'll point you in the right direction. So just in closing, I was going to go through and show you some of the other initiatives that we've got going at AMPC at the moment. And I might just check if you can see my screen now.
Yep, I can see your screen, Amanda.
Yep.
Perfect. Excellent. So just some other safety projects and initiatives that we've got going at AMPC at the moment include, and for some reason mine doesn't want to, I might just not be able to go to slideshow. Can you still see that, Gemma? Can you see our project team?
Yep.
Yep. Okay. So sorry, I won't be able to go to slide mode for some reason. So just for anyone that's new to the industry, and I know we've got at least 2 people on the call today that are relatively new, this is the AMPC project team. The key contacts for core programs is Sean Starling, who's our Senior On-Plant Innovation Manager. Then we have Stuart Shaw, who is the Advanced Manufacturing Core Project Manager, and Stuart and I are working really closely on a number of safety initiatives. Matt Deegan, who is the Program Manager for Sustainability, and Matt O'Brien is the Senior Program Manager for Integrity and Products. And then I'm the Program Manager for People and Culture. We then have our co-innovation managers, who you've just met, Gemma, who is from Victoria. Then we've also got Blair in Western Australia. So any of our Western Australian people that are wanting some further information, please feel on Western Australia, please reach out to Blair if you haven't met him. He would love to introduce himself to you. We've also got Greg Williams in Northern New South Wales with Dave Dwyer. So that sort of covers off our states, and sorry, Dave and Greg also cover the Queensland processes. So what's driving projects in the people and culture area? As you've heard today, we had through the surveys, lacerations and manual handling came up in one of the previous surveys as saying that they're still our highest injuries for the industry. So that's really the key focus on some of the projects that we're working on at AMPC. So the first one, if anyone was lucky enough to attend Beef Week or your co-innovation managers have actually been on site and brought their exoskeletons, you may have been able to have a play with them. But what we're looking at is what are the uses of exoskeletons, either powered or non-powered in industry. So currently each of our co-innovation managers has at least one unit of the ESCO brand, which is a brand out of the United States. Furthermore, we're actually looking at getting in a whole different range of these suits from different companies and evaluating them. We're actually going to use an ergonomist to go through and evaluate each of them to actually see what are those demands that the body is under in a normal work environment, and then what does it look like when you put on an exoskeleton suit, and then give some recommendations back to those providers on what are the things that may need to be changed for industry to adopt them further. So please, if any of your co-innovation managers, not that many of us are allowed on sites at the moment with COVID and our cross borders, but it's something that we'll make sure that we will bring to site when we can, and also once we get the network meetings up and running again. So we'll give you updates on that project as it goes through. So knife sharpening, as you've seen earlier in the presentation, knives are one of those areas that we're still getting a lot of lacerations and also probably contributing to those musculoskeletal injuries that we have as well. So we're just in the final development stages of a knife sharpening app, and I'll just run the little video so you can see there that what it does is they'll actually video somebody stealing a knife, and then I'll skip through here a bit, and then they can actually measure where that angle of that knife is, so which is a really good training tool. So at the moment, it's with the Apple Store, and we're just waiting to get final approval, and then that will be released. So once that's released, we hope that that will be a valuable training tool that industry will be able to use. Furthermore, if anyone does their animal welfare audits or part of the maintenance department, you'll actually be able to measure your angles on your races, etc. as well. So I'm looking forward to seeing that one come out. We're actually going to look to do a webinar dedicated on knives in the near future. But one of the other projects, we've found some really interesting information around cut-resistant gloves and what people and plants need to consider when they're actually looking at purchasing cut-resistant gloves. So we'll do a webinar on that shortly. And another component of that knife sharpening project is knife evaluation. So we've got a provider currently at the moment looking at what different knives are available and what sort of changes could possibly happen to knives, including handle sizes. So we all know that we have a huge range of sizes in our employees in the workforce, and does actually the one knife handle fit everyone at the moment? So, you know, maybe down the track you'll have, just like trying on a pair of shoes, you'll be able to measure your hand against different hand sizes, and possibly, you know, should you be selecting a different knife handle size for that particular employee. So we're going to be doing some evaluations around that. We've also got a knife sharpening pip that's been happening or that's commenced with a couple of plants, and if anyone else is interested in looking at doing anything in the knife sharpening space, please reach out to your co-innovation manager or myself. Another really exciting area of work that AMPC has been working on is AR and VR technology. So, you know, and what are the possibilities of training? Everything from when somebody's first onboarded, you know, putting them through a washroom scenario. Here's an example of one that has been worked on as a PIP. This is actually in an maintenance engine room, and going through and having a look at, you know, doing all those safety checks and click it, and, you know, do you need to look at that work instruction further? Have you, you know, you need to open that valve, you need to have a look at what the pressure is here and possibly record the pressure. So there's a huge range of possibilities, especially in the safety space in around here. Yesterday, a couple of us had a catch up with another company using VR around a whole range of off-the-shelf training resources, including fire extinguisher training, confined space training. So we'll be further investigating that and having those hopefully at our network meetings and at our innovation conference next year, so that people will be able to look at those further. But this is definitely a big game changer in terms of training and that awareness of people from a safety perspective in the industry level. Another one that, and this is very much in Stuart Shaw's area around shadow robotics, having a look at what are the possibilities in using and what are the limitations around sensing and visioning systems around and manual handling. So I don't know if anyone's previously seen this sort of technology, but you can see a person is mimicking being able to put cups on, and then the robot is able to follow those instructions. We feel that there is a huge possibility for this technology within industry, and possibly to be able to remove some employees from those more dangerous tasks, not actually taking the employee out of a job, but just putting them into a different environment. And same as you can see in the bottom photo here, this was at our Beefworks stand, where we had another shadow robotic option where the gentleman here is actually guiding a robot and marking lines for beef scribing. So there's a lot more possibilities in this space, and Stuart would love to, I'm sure, to talk to more people in the future around the possibilities, and also opens up our workforce further. Then we've been doing some work, and there's the AMPC team has really been immersed in this virtual reality space, and we've created basically it's gamification, a game around beef scribing. So what this is to be able to, I guess, at one level, attract and train people in this instance around beef scribing, and then further down the track, you know, is it possible that we can actually remove that operator from doing it actually on the floor, and could they be doing it in a training room or sitting at their home in Tumut, for example, and a robot doing it on the floor. So this is a really exciting piece of work that the team's currently working on. COVID support. Everyone's probably sick of hearing about COVID at the moment, but we've got a number of resources. If you haven't seen them, please reach out to me and we will be able to send you the links to the relevant information. But we've currently got a COVID Marshall course, which is compliant with the South Australian and Victorian requirements, and it's very much more around processing. So We've had a good uptake of it so far, but there's definitely still room if anyone would like to undertake that course. You can access it from the front page of the AMPC website. We've also got a syndicated PIP, which I've spoken about previously, to help support plants in reviewing their COVID, or if any plants are wanting to have conversations with Respond Global, who have previously done webinars around vaccination uptake. We've just released 7 videos around COVID, and they range from everything from how to put on a mask properly, general hygiene, through to, and there's a vaccination one. They're currently being put into 4 different languages, and that should be completed by the end of or early next week, hopefully, so they'll then be released. We've also got infographics that are available as well. So if anyone hasn't received those and would like them, feel free to get in contact with either your co-innovation manager or myself. And lastly, the Guardian 900 bandsaw. So this was actually a project that was done under a PIP recently with a processor. With its success, we then brought it out and showcased it at Beef Week. It is now currently in Western Australia, but we have a project. So if there's any plants that would actually like to try and use the Guardian technology, or at least the 900, which obviously there you can see it's a much larger bandsaw, please reach out. We've got a project where plants can actually test it for a 3 to 4 month trial period to see if it's actually going to be fit for purpose for their business. So anyone that's not familiar with Guardian, the technology is similar to the blade stop technology. So if your fingers come close to the blade, there's the blue light sensor as well as the sensors that the operator wears. The Guardian also records all the movements that operator does. So if you want to use it from a training perspective, you can actually go back and show an operator the video. So that is a quick summary of some of the other safety initiatives that we are currently working on at AMPC. So just in closing, I'd like to thank all the presenters today that were involved in this webinar, especially to Simon, Jay, Dav, and also to Gemma for giving us all the updates. And we look forward to seeing everyone in the near future. I don't think we've got any questions, so I'll close the webinar now, but please feel free. I think everyone's probably got my contact details. If you want to either reach out to myself or any of your other co-innovation managers. Thanks very much.